Hello, I'm Julianne Pleeke. I'm the director of the Pediatric Comprehensive Epilepsy Program at the Komansky Center for Children's Health at New York-Presbyterian Hospital. This is the entrance to the PICU where both patients, well-wishers, and all medical personnel first enter. This is the first place of entry, if you will, then, where people can check in, find out where their patients are. Often this is a place where many teams will join and discuss the oncoming morning plans. We'll even meet to make a daily roster of what's ahead for many of our patients. This is our Neuro PICU, and it's a specialized neurologic pediatric intensive care unit. This is very unusual to have a very specialized unit just for the neurological care of the critically ill pediatric patient. There are very few of these really in the nation, and we're very proud to offer this here at the Komansky Center for Children's Health at New York-Presbyterian. We have the capability of admitting up to 4 patients whose primary critical care need is their neurological care. We will have dedicated nursing to this unit. There will be at most 2 patients per nurse, and typically only just 1 patient per nurse. And this is a closed unit. Who do we intend to admit here? Well, first of all, of course, it comes to mind patients who've had trauma. And we are a top-level trauma center, and we will be admitting patients who have any kind of trauma who then puts them at neurological risk. We have the ability to do any kind of neurological or neurosurgical intervention that these patients need on an ongoing basis. The technology around me that you see is going to allow us to continually monitor these patients. In addition, we've already partnered with Technion to put all of this information into one computerized dashboard that physicians and nurses will be able to monitor on a continuous basis from really anywhere, so that they can be anywhere in the hospital, their operating room, their offices, even at home if they're taking call from home, and continually monitor their patients' vital needs. This is going to allow us to have very acute insight into how the patient is functioning. But what other kind of patients will we have here? Many, many patients who are critically ill do suffer from encephalopathy, delirium, and just are not as responsive as they were. This unit will allow us to uncover what's going on in their cognition and in their thinking at that time. We will have the ability to have ongoing EEG, as I mentioned, ongoing neurosurgical monitoring to make sure that their brain health is a primary focus of ours in their recovery. And we're very excited by the possibilities that we'll have to offer here. In this room, each of the beds is available for continuous digital video EEG monitoring. This is fed into our servers, and we're able to, any of our epilepsy attendings who have undergone specialized pediatric epilepsy fellowships are able to read this data on an ongoing 24/7, 365-day accessibility for these patients. We're also incorporating amplitude analysis of the EEG to the ability to monitor trends in EEG monitoring. We've already begun partnering with our neurosurgeons in order to put in subdural grids, depth grids, whatever is necessary for the patient, not just for monitoring, but also for seizure localization. We are a top-tier epilepsy center, and in terms of our ability to localize epileptic foci for the documentation of patients with intractable epilepsy. Our goal is seizure freedom, and only by good localization can a patient expect to have seizure freedom.